Hi class, I'm Josh Macias, and this is my project on 3 common injuries that are found in Supercross and Motocross. The ACL injury is the first common injury that dirt bike riders or athletes who do Supercross and Motocross um, have. The anterior cruciate ligament is the overstretching or tearing of the ACL and the knee. The ACL, it prevents the knee from going too far forward, and it's pretty much held in place. This happens when this usually happens when the foot gets planted and the distal end of the femur bone, it has to turn, it can creates a rotational force, and that rotational force gets too much and it tears the ACL injury, the ACL, which results in a torn ACL. It's very painful. Here is a YouTube video showing what happens. I'm going to fast forward. This is just pretty much going to show you what the normal knee, how the normal knee does before it's injured with an ACL injury. As you can see, I'll fast forward now. Here is an example of an ACL injury. The upper leg rotates while the lower leg is planted. Here's this football player. He is going to do a cut move, and his leg is planted, and now he's going to try and go the opposite way, which creates a rotational force, which then is going to tear his ACL. This is going to cause him a lot of pain, and he's going to have to be wheeled off in a car, as you can see. Going back to the presentation, the mechanism of the ACL injuries, it's when the anterior cruciate ligament is usually torn by quick deceleration, hyperextension, or rotation without contact from another person, just like what we saw in that clip just now. Sometimes it also happens when there's contact, and it happens to be on the side. The ACL injuries are usually associated with the medial meniscus and medial collateral ligament tears, or medial collateral ligament, and it's also known as a MCL. To assess for an ACL injury, then obviously the injured ligament is the anterior cruciate ligament. The first test, it's the jaw test when the knee is at 90 degrees. While the knee is at 90 degrees, the physical therapist will apply firm anterior force, first with the foot pointing straight. If there's any pain, obviously that results in an ACL tear. The second test, it's a Lockman jaw test. This is when the patient lies supine on their back on the table with their knee flexed 15 to 30 degrees. The trainer grabs with one hand the leg above the knee, and the other hand will grab the upper and medial side with and then the femur is also held in place with the upper hand, and the lower hand pulls the tibia forward. Positive results from this test results in damage to the ACL. The The next kind of test is the pivot shift test. The patient lies supine. The athletic trainer grabs the head of the fibula and the ankle. The lower leg is internally rotated, and the knee is fully extended. The thigh is then flexed at 30 degrees, and the hip while the knee is at the hip while the knee is flexed. The trainer applies simultaneous valgus force with their upper hand. During this part of the test, the knee is flexed 20 to 40 degrees. And when this happens, the lateral tibial plateau will have a palpable movement. The next kind of test, it's called the jerk test. It's just the same kind of test as the pivot shift test, is just in the opposite direction. The next is the flexion rotation drawer test. The lower leg is cradled with the knee flexed at 15 and 30 degrees. At 15 degrees, the tibia is subluxated anteriorly with the femur externally rotated. And then at 30 degrees, the tibia reduces posteriorly and the femur rotates internally. Obviously, if there's any pain that shows, then it results in it may seem that they have an ACL tear. The next common injury that I've found is the torn rotator cuff. When one of the four tendons in the shoulder tear from being overused or from falling on your shoulder. Usually pain and weakness in the arms are the symptoms. With this injury, to identify it, it's when either the teres minor and infraspinatus, supraspinatus, or subscapularis is torn in the shoulder, resulting in instability in the shoulder. Usually, an athlete that has this type of injury, they will show pain and weakness in their arm, and their arm will just like hang. Um, and so that's a good sign that it's, well, not a good sign. That's a sign that it's that they possibly have a torn rotator cuff, and there will be, I will mention later, a little later in a couple slides, what the tests are for this type of injury. Here is a picture of one of the tendons, the supraspinatus tendon. As you can see here, it's torn. It's one of the four tendons that are part of the rotator cuff, and it causes a lot of pain, and they will usually hear a popping sound in their shoulder too. To common mechanisms of injury for torn rotator cuff is falling on your shoulder. With dirt bikes, this happens a lot. Using an arm to break a fall, that happens a lot too. Sometimes you can't help it. Lifting heavy weights. And athletes who are in other sports that this injury is common are pitchers, swimmers, tennis players, and football players. Torn rotator cuff assessment and anatomy. To assess for a torn rotator cuff, you palpate it, you observe it, you test the range of motion, and and you give them some light resistance muscle exercises to test out how strong their shoulder is. The focus tests, there are the first test is the empty can test, then the drop arm test, the abrasion sign, near sign, Hawkins-Kennedy test. The empty can test is when the arm is in front at 45 degrees to the body with thumb pointing to the floor. The athlete will raise the arm with the resistance test. This tests the supraspinatus tendon. The drop arm test, or the Codeman's test, the arm is moved above the head and gently lowered back to the side. Not able to do slowly and under control or has pain. This suggests that they have a torn rotator cuff, specifically in the supraspinatus. The abrasion sign. While sitting, the arm is to the side with the elbow flexed. Rotate. The arm is rotated anteriorly and posteriorly. If crepitus appears, inflammation or degenerative changes may have occurred. The next test is the near sign. Arm is positioned with thumb facing down and at a 45-degree angle to the body. The arm is to be lifted up above the head if pain or discomfort. Impingement of the supraspinatus may have occurred. Last kind of test is the Hawkins-Kennedy test. And with this test, the arm is raised in front of the body at 90 degrees, and the elbow is bent. The trainer will immediately rotate the arm. If pain occurs, may have impingement of the supraspinatus. Here is the picture of the empty can test. This is the drop arm test. This is the abrasion test. Here's the nearest test, and here is the Hawkins-Kennedy test. The third common injury is the broken clavicle. This is when there is a direct blow to the shoulder, like during a fall or a fall on an outstretched arm. The collarbone usually breaks near the rib cage, or the clavicle usually breaks near the rib cage or the scapula. Here is a YouTube video of a dirt bike rider that broke their collarbone. Just going to show you part where he crashes. That's where he breaks it. So Danny Orange lands directly on his shoulder. You can kind of see when he goes away, there's a slight slant in his shoulder.
Are you okay? Did you break anything? Are you good? You're a little scraped out. What hurts? Shoulder. Oh.
So as you saw, he landed straight on his shoulder, and that's how he broke his clavicle. Because I've know some guys that have broken their clavicle, and it's actually extremely painful. You just don't feel it because of the adrenaline rush. The common mechanism of injuries for broken clavicle are caused by fall on the lateral shoulder or a direct blow to the clavicle with an outstretched arm. To assess a broken clavicle, obviously the affected bone is the clavicle. To the examination process, there is a diagnosis of a broken clavicle is easy since it is superficial and easily palpable and will be examined from behind the patient. Uh, the trainer should auscultate the lungs to make sure there is not a complicated pneumothorax. Next, they should perform a neuromuscular examination of the injured side, check for pulses, lack of perfusion, including changes in skin color and of the upper arm, limb, and assess sensation and muscle power. And then they should perform an X-ray to identify the severity as well. Here is a list of my references that I use for this presentation. Thank you for your time, and thank you for listening.